So let's review our referral process and the ways that we capture whether or not a person has a primary care provider. First thing we want to do is if a person has a PCP, primary care provider, we want to be sure that it's listed in their demographic information. This is going to be really important later on. This patient has indicated to us that they don't have a PCP, and so we are going to mark no PCP. If they do have a primary care provider, we want to make sure that that is noted here in the PCP screen. If their primary care provider referred them here, we also want to make sure that we have that captured. But if they were referred to us some other way, we can mark that here. If we're trying to fill in their primary care provider and they are not listed here, then you want to click the three dots, and this is where you can search. And we can just put the PCP right there. And then once we click Save, we have that information captured. Now, when we have a patient that does not have a primary care provider, we'll have a notice here that says needs to select a PCP. And we're going to take the initiative to refer a patient to a primary care provider. At After Hours, we really want our patients to have a primary care provider. It's just a good idea for good overall health care. So now, let's say we're going to do an outgoing referral. And we're going to put whoever is on duty is who the referral is from. We're going to refer them to a primary care provider. And the specialty is going to be family medicine. There it is. We want to make sure transition of care is marked no, because they haven't chosen a PCP yet. Referral is going to be PCP referral. Did I spell that right? Yep. From date's going to be today. And in the notes, we want to put referred to PCP. We're going to save and print because we want to print this out for the patient and hand it to them with a list of nearby primary care providers and some maps so that they can find them. And the next step is that we want to go into the patient's chart and start a letter because we want to refer them to a PCP. We have to be careful though because this patient hasn't chosen a primary care provider yet, so we're not going to use their full name. And so we're going to be sure that we have chosen the outgoing referral letter and the correct encounter date. And you'll see that the letter here addresses the PCP that we're referring the person to, and it only has the patient's first name. That eliminates any kind of risk that we are giving out private patient information. It's very simple for us then to click fax and fax this on over to that provider. And at this point, you would just follow the fax procedure to send it over to, in this case, Michael Dunn, who we are referring Miss Test to. For our patients who have a primary care provider who has referred them to us, we want to be sure to send a thank you note. Just like your mother always said, you send a thank you note when someone gives you a gift. So we're going to click on Letters, Referral Thank You. And this is going to pull up information that we're going to need to send a nice little thank you note. It lets the provider know that their patient was seen here, and we're going to be sending over some records, and it has attached all the documentation from the patient's visit.